For those of you that don't know me, I'm Dr. Nicole Labor, addiction medicine physician, person in long-term recovery, and your sweary godmother to all things addiction and recovery. Most people hear MAT and they immediately think methadone and buprenorphine, and that's it. And they build this entire fucking passionate narrative around the idea that we're just replacing one drug with another, which honestly tells me that they don't understand addiction neurobiology, they don't understand withdrawal physiology, they don't understand pharmacology, and surely they don't understand the purpose of treatment. But okay, moving on. First of all, buprenorphine and methadone are not the only MAT medications, not even close. We also have naltrexone, which interestingly enough, naltrexone is FDA approved for both opioid use disorder and alcohol use disorder. Same medication.
If you've ever had a car on finance with Black Horse, listen to this. You could be
different substances. Why? Because we're not replacing one drug with another. Addiction is about reward pathways, dopamine signaling, stress systems, reinforcement loops, glutamate memory circuits, etc., not just the drug. And it doesn't even stop there. ASAM released guidelines recently that discussed medications for stimulant use disorder, which were things like Wellbutrin combinations or Topamax or baclofen in some cases, other off-label approaches depending on the patient and the evidence. We've also seen medications help behavioral addictions like gambling or compulsive sexual behavior in certain people. And then there's things like disulfiram for alcohol, you know, the medication that makes you projectile fucking vomit if you drink. So yeah, MAT is not, here's your replacement heroin. That's not what this field of medicine is about. MAT is using medication to stabilize your neurobiology long enough for people to function, to heal, to reduce risk, to stop dying, to hopefully start rebuilding a life, because the MAT medication used correctly is not creating these dopamine spikes in the same way that the drugs of abuse do. And honestly, the irony in all of this is wild, because a lot of the same people who aggressively judge MAT are perfectly fucking fine with psych meds. Like, SSRIs, cool, ADHD meds, fine, mood stabilizers, totally acceptable. But the second addiction enters the conversation, suddenly everyone's a fucking neuroscientist with very strong opinions. Meanwhile, many of those same psychiatric medicines are now being used within addiction medicine because brain systems overlap. So maybe pump the brakes on the judgment a little bit. You do not have to personally choose MAT for yourself. You don't have to do that at all in order to acknowledge that it saves lives for other people. And if your understanding of addiction treatment begins and ends with you should just stop, then respectfully, your opinion may be based more on emotion than on science. Anyway, hope that was helpful. Thanks for hanging out. We're not just recovering, we're reconstructing.